So we're going to use our stuff that's sort of like liquid nitrogen, but not nitrogen exactly. And okay, so I'm just going to talk about you like you're not here. Okay, so here's what we're looking at. There were 2 small warts on the heel here, and I put an acid patch on here. But you said that the patch moved, and it looks like the acid went here instead of here, right?
Mm-hmm.
The patch
Yes.
came off and right, okay. So, so the acid treatment got here. We're just gonna leave that. That's probably just a little blister right there. It'll take care of itself. But when we look at these, you can see, again, how we know that they're warts and not just calluses is that you can, when I get the stuff trimmed off here, you'll see that there's a little bit of a capsule around it that it forms, and that the skin lines or the fingerprint lines don't go through it. Well, in looking at these, I mean, they're very tiny. That's one right there, and that's one right here. So these are all these are both like a millimeter in diameter. They're tiny, but if we don't get them, they will spread. So what we're going to do is not do the acid again this time. So again, there's one right there, and that's the other one right there. So we're just going to freeze them, and so we're going to use our stuff that's sort of like liquid nitrogen, but not nitrogen exactly. And all right, so do you want a Band-Aid on that?
I would, please.
Okay. So we will see you back in about 2 weeks.
Okay.
And we'll do it again until these are gone. And if this little white spot here from the acid, if that blisters,
Mhm.
that's okay.
Okay.
I mean, if it starts to drain, that's okay. It might have a little blister under it, so. Okay, we're good. This is Jack, and Jack is here because he has a wart on the back of his heel that we've been treating for several weeks. Probably better for you to come over and help me, because I'm gonna be. So the first thing is that we thought this was gone, and because the warts are very tricky these days, they can look gone, and then if we stop treating, they'll be right back. So what we did was we asked Jack, not his real name, but that's the name he picked. We asked him to come back a month after it looked like it was all gone. And so what we're doing today is we're just checking to see if this wart is actually gone. Now, is this painful, Jack, in your shoes?
No.
Okay.
No.
Initially, when we started treating it and it was much larger, was it painful in your shoes?
Not particularly, but I didn't want it to get to that point either,
Okay.
which it had been before.
Right, because we did this a year or two ago
Right.
as well. Okay. So it's been a little under a month since we thought it was gone. And what I see here is are you zoomed in real close? Okay. So right here you can see it looks like there's a little shell around this area, and with warts the fingerprint lines or the skin lines stop and go around them. So this is a little bit hard to tell, but I can look at this and say that the wart is not, in fact, gone. And so it's a good thing that he came in, because if we just said, see ya, he'd be back in 6 months and it would be much bigger and harder to get rid of. So what we're gonna do is we're gonna freeze it today, and then we'll freeze it every other week until it's gone again, and then we'll recheck it a month after that. How's that sound?
Great.
Okay, not what you wanted to hear, I know.
No, not exactly.
Okay, so this is pretty much the same as true liquid nitrogen stuff, and we do it a little differently. We spray it into this cone, and you can see it's bubbling or boiling at room temperature. In the can, it's under pressure, so it stays a liquid. Can you see inside there? Where it's bubbling? So basically, it's a liquid that boils at room temperature, and that's what freezes the wart. Is anybody counting? I'll call it 30. Okay. Then we let it thaw out, and we do it one more time. So we'll wait till it goes normal skin color. So it's tiny, but these things are really difficult these days to get rid of. Want a Band-Aid over that?
Sure. You got one.
Just for comfort. All right. We'll see you back in 2 weeks.
Okay.